Welcome.
Bienvenidos.
Welcome.
Welcome
to Cornell Scott Hill Health
Recovery and Wellness Center.
For anyone suffering from trauma and addiction, the journey from hope to healing is just that, a journey. From our early stage Grant Street Partnership Program, where the dream of providing comprehensive behavioral health and addiction services was first put into action, to facilitating hope and healing in so many ways at our extraordinary new Recovery and Wellness Center, we're dedicated to being on this journey together with our patients, their families, and the greater community. What we offer patients is so special and so different than the norm that people travel from far and wide to access services here at the Cornell Scott Hill Health Center. It actually costs a lot more not to treat the addiction. It costs in the quality of the individual's life. It costs in how productive they are as a human being. It costs in their ability to contribute to society. It costs because quite typically, those individuals who go untreated are admitted to hospital settings again and again as they recidivize because the underlying issues contributing to their addiction have not been addressed.
Addiction is a medical disease, so you need multidisciplinary team. You need your nurses, you need your medical providers, you need your psychiatrists, you need your therapists, and you need your recovery coach, case manager, without treating underlying cause of trauma. Without treating post-traumatic stress disorder, the recovery will not be long-term.
I had somebody who unfortunately was referred through an outside agency in the form of DCF. She was drinking every day, didn't have any primary care, didn't have any dental, didn't have anything else. We were able to connect her with a primary care provider. We had her go through detox. We connected her with dental assistants as well. She got everything that she had needed. She engaged in our IOP program, our outpatient program, and it was maintained at the outpatient level of care for an extended period. So when you address all of these things at once, you can really see the results.
Historically, we have only been able to serve men with our therapeutic shelter services. And with the Recovery and Wellness Center, we are so pleased to be able to offer 12 additional beds for women. We know that there is a particular need, not only in New Haven, but across the state, for more programs focused on women. We see rising rates of alcohol use disorder for women. We know the importance of trauma-informed care, and our ability to really offer some integrated, tailored programs towards women, I think is going to be a real asset to New Haven and the state.
When I first came to Grant Street, I wasn't the ideal client, but people understood that I was a mother, I was somebody's sister, I was somebody different before substance use. Once you stop the substance use, that's just like a small part of it. Then you start to work on everything else. You want to feel good about yourself, your self-esteem. So once you get that outside appearance looking good, then you feel good on the inside. I am studying substance use counseling, and I am super excited about it, because there's so many people out there that need help, so many people that do not know that there is treatment available that actually works.
We need to treat people beyond just their diagnoses. We need to treat them beyond the substances they use and offer them access to holistic modalities that can help them be able to heal themselves. I'm a firm believer in yoga as an adjunct treatment, auricular acupuncture, acudetox, offering meditation, mindfulness, helping them have the skills that they need beyond just not using substances.
I've been with the organization for over 34 years, and this Recovery Wellness Center is a dream come true. I love talking to people and helping them and making them feel happier and better about themselves. Clients are coming in asking for assistance with shelter, housing, and we have case management that's there to help them find sober housing and assist with basic needs.
I consider it part of my job as a clinician, not just to educate clients, but their families and even the community. It's really impactful when we can bring the family in and explain treatment to them, because for a lot of them, it's a mystery in some ways. We can really kind of let them see behind the curtain that this is what we're trying to do for their loved one, and this is what's going to help them get better.
I think treating the whole person is the most important thing that is going to change the path of this epidemic that we're in. I like to say to people, when somebody has cancer, we don't shame them. We don't ask what they might have done that might have caused that illness. In 2018, right after Cameron died, my daughter Isabel and I were trying to be advocates. We were meeting a lot of roadblocks. And somewhere in there, I reached out to Cornell Scott. The warmth with which they embraced us immediately became a huge part of our healing. Hearing about this Recovery Wellness Center is so hopeful to me. And I know this is going to make such a difference for patients, because recovery is possible if it's supported in the right manner and the families feel supported. And I know that this is going to do that.
When I first came to Cornell Scott, it was something as simple as a vaccination. I was lucky enough to be included in this vision of a recovery and wellness center. It's an extraordinary privilege to be part of it, and I know that it is worth every bit of time, talent, and treasure that any of us can dedicate.